Okay, so let's talk about access points. Access point is a point on the patient that basically allows you to get right into their energy. Access points can change. I look at mine and it's basically, it kind of changes. Sometimes it changes monthly, sometimes it changes over a couple periods of time, maybe 3-4 months. And basically what it is, it's an access point on the patient's body that you actually adjust to just get them ready to receive the best adjustment possible. So if you find yourself always getting right sacrum or always getting left clavicle, it's not that that patient has it, it's not that you have an issue, it's that it's the universe's way of telling you that you have an access point, and that's how you're going to get them into their energy. So I find for me, I'm always following the OD. So I always ask if the patient's open. Second question is, is there a priority? Above the waist, below the waist. And then if I get right now, because my access point is a left hip, I automatically will go into, if I get below the waist and I get the drop in below the waist, I'll ask left hip. If I get a yes, I know it's my access point. It also, if I'm not getting an access point really quick, it means that I'm not focused. So, and if I'm not focused, the patient's not getting the best adjustment either. So I find it really hard to talk while I'm adjusting. So I'll find that if I'm talking, the access point has to come kind of repetitively up. But usually once I adjust an access point, I'm just into that patient's energy. So gently, it's just more of a gentle opening. It is not a very specific adjustment. So you're not adjusting left hip down. You're not adjusting. It's more of just a gentle opening. So they can be in different rooms. I find that I have a different access point in one of the rooms that's a little different energy. So they might switch in the rooms. And all of a sudden you might find that if your energy's off a little bit, the access point might be a little different, but usually they tend to kind of remain the same and a little bit steady, and then all of a sudden they'll just kind of change. So that's why I'm always following the OD, always asking what the priority is, above the waist, below the waist, and going through my priority list, but then I'll actually go into my access point. Once you adjust, you clear it, you open them, and then you can go right into adjusting like how you would normally go. So find the access point. You can ask, use your OD. Do I have an access point? Is it in this room? Is it this place? You can always ask and use the OD to find out what the best access point for you is. And then they do switch sometimes for patients. So it really depends. So hopefully it helps explain what an access point is.